Assalamu alaikum wa rahmatullah. I am Dr. Ahmed D. Abdulwahab. I'm an interventional and diagnostic radiologist working in Erbil. Today we will present a case of a 17-year-old male patient presented with left iliac fossa mass and localized pain and tenderness with difficulty of movement of the left hip. CT scan was requested as shown here. And let's start by taking a quick look of the CT scan. You can see here, this is the abdomen and pelvis CT scan. I'm scrolling around to make you see the findings. So first of all, we have obviously a large mass here in the left iliac fossa, both at the intrapelvic and extrapelvic compartments, and it's extending from both compartments. Here you can see that, and you can see that the bone is not destroyed, it's invaded, and we can see the bone window here to check the bone, and you notice that the bone is basically intact apart from some sunburst type of periosteal reaction, but it is not destroyed. And so basically there is a large, huge soft tissue component surrounding the iliac bone, the left iliac bone, and is causing mass effect on the left psoas muscle and basically replacing the iliacus muscle, and also some invasion of the glutei muscles with obvious periosteal reaction, mostly sunburst type. And if we notice that there are the iliac vessels here, the external iliac artery and vein, and you can see here there is something within the left iliac vein. It's not taking contrast, or it's hypodense. If we make a hard window, it's hypodense compared to the other side. So there is this large iliac fossa mass surrounding the iliac bone with sunburst type of periosteal reaction causing mass effect, invasion of the surrounding soft tissues. The bone is not destructed, it's not invaded. There is some periosteal reaction here, and you can see there is something within the iliac vein on the same side, ipsilateral side. There are no significant para-aortic lymph nodes, and you can see the liver is intact, the kidneys are intact. Let's see the coronal images. Just let me adjust this for you so that you can have a good look. And let's see now, these are the coronal images. You can appreciate the size of the mass here, and you can see the relationship to the adjacent structures. I think we can do better if we there are some late post-contrast images. You can see the kidneys excreting the contrast, and you can appreciate that contrast is passing into the urinary bladder. With this is the left ureter and the right ureter here. So the ureter is also the left ureter is displaced to the right side by the mass effect of the above mentioned of the previously mentioned mass. Sorry, and let's see the coronal images. Just a second. What can I do? Yeah, okay. And you can see here, this is the mass that I'm talking about, and you can appreciate its relationship. The mass, of course, it's heterogeneously enhancing with a central necrosis. So, what do you think? What is the diagnosis or the differential diagnosis of such a mass, and how can the diagnosis be proved? What should we do to the patient, and what other complications are arising from this mass? Write your answers in the comment section, and I am waiting for your answers, please.